everyone, and welcome once again to this amazing episode with us here on Thumim NG. And okay, let's calm down first. Were you feeling that music? Like it feels like an orchestra kind of music, and the videos, the pictures are all showing. You can take this chorus, you can take the other one, and I was just there dancing to the music. I don't know if you were feeling that a hot feeling like, oh my goodness, take me to heavens. That's exactly how I felt, and I'm so happy to have you here again. Thank you to all our viewers who just joined in. I can see you all really. You can give us a shout out and trust me to bring it up there on the screen. So, today we'll be talking about an amazing person. Of course, you've heard the topic. So, the amazing person will be joining us here to have a chat on sickle cell disease. Yeah, we just want to know, can sickle cell disease really, can it be treated for real? And we'll be having Dr. Oluwayemisi Olagunju. All right, I'm going to definitely give you all the shouts and everything you need to know about this wonderful lady. But before then, let's check out what's happening there on the comment section. You know, you can interact with us, give us a shout out, give us a question, anything, and I'll definitely bring it up. So, Beauty of Wayemi said, all right, before now, she just said, I can't wait for this event. Thanks, Doc. Thank you. The event is live now. Join in. I hope you're seeing us right here. And then we have Paulina. Paulina was saying, what an opportunity for more knowledge acquisition. Great. That's an awesome one. I'm happy you're just acknowledging it even before we started reeling everything out. And then Toyin is saying, here for my teacher, Dr. Olagunju. Thank you, Toyin, for joining in. And we'll be having this wonderful session. You can see the people already giving up or making all the necessary noise about this lady. So let's have a short talk about who Dr. Olua Yemisi Olagunju is. So you can see the fine woman smiles or smiles over there. And she's Dr. Olagunju Oluwayemisi, born on the 30th of June 1978. Please save the date, 30th of June, so you can get her birthday cake once it's there. To Pa Samson Olatunji Ajayi and Mama Oluwafumilayo Ajayi. She got to know of her status as a special child since childhood, and her primary education was completed by the age of 10 and completed her secondary school before her 16th birthday. So even as a special child, like special in all round, like you can see 16th birthday, she's done with secondary school. And her journey to the School of Nursing charted a different course for her sickle cell disease experiences. Like I had to spell out those acronyms for you. Self care for her was the skill that assisted her in the face of stigmatization. Really, we have her today. We'll have her tell the story. It's not going to be from my mouth, really. And she kept showcasing herself as a face of sickle cell disease, raising hope for the younger generation with sickle cell anemia. Ladies and gentlemen, Dr. Oluwayemisi Olagunju. Applause, applause. Thank you. Thank you for joining us here today.
Thank you once again for having me on your platform.
All right, before I say anything, I really have to give you this thumbs up. You have great fans. Like we are just barely 5 minutes, okay, 6 minutes into this particular show, and we have 51 viewers right now. Ha! I'm so happy for that. Let me just quickly go through what the people are saying here. Debola said, "Oh, good to be here. Good to have you too. We are happy to have you." And then Fumilayo, thanks. I'm glad to be here. I'm glad to have you too. What's okay? Adeta Kuba said, Dr. Lagunju, you're welcome. You can see. And your namesake, Oluwayemisi, said, well done. That's an interesting topic to discuss on. Great. This is going to be an interesting one. I'm happy to be here, Dominic. Um, Adeshola said, proud of you, Dr. Olagunju. And you have
That's my
Oida
teacher.
Mala. Oh, Tish, I have to bring it up again so that everyone can see Dr. Adeshola is proud of her student, Dr. Olagunju. Okay, and we have Oyedamola clapping. Like I have to clap it out so that you can hear her claps. And then we have Faith Temitope. She's so eager to be here. definitely knows it will be mind blowing. God, I'm having so many comments here, and I want to make sure I acknowledge everybody. You have Fumilayo here who is washing hands for you. Ooh, and then Idowu said, well done, ma. Bukola, proud of you, ma. Ah, you can see so many comments. But so then thanks, Dr. Lagunju, for this great awesomeness. You all are really blowing out my mind here because I hope I can keep up with this. Aderemi said, great, well done. And then Oluwa Sheyi, you are celebrated, ma. Definitely. Then we have Dokas, we're so happy to be here. And Oyeda Mola, my always amazing supervisor. Great. Ibukunle, well done, ma. Thank you for that acknowledgement. Originally, Elizabeth, I am happy to be here. And we have Olagunju too. Happy to be here. And then I think I have won you all. Mokam Adriel. Yes, I am here to learn. My down to earth teacher, I love you, ma. Okay, you people don't really want me to win this game. When Michael just put up his own and said, proud of you, mommy. Dr. Olagunju, I'm delighted, ma. I have won. This is the last comment so far. When we have others, we'll definitely put it here. And I am really happy to engage you all. Today we'll be talking about, can sickle cell disease be really treated? And the interesting thing, really fascinating, is that it is not just a topic, it's going to be discussed by a sickle cell person. Like, I just have to call her a survivor, a warrior, a person, a special child, like she likes to describe it, because that is what it is. And we have Dr. Olagunju with us today. An interesting one. Like, we have our questions, but interactive session is always awesome. Dr. Oluwayemisi Olagunju, I have done so much talking. Can we just hear, how do you feel being here today with all amazing people everywhere? Hey, Dr. Lagunju, we are happy to have you. How do you feel joining us here today?
Thank you once again, and a very good day to everyone that is joining us. It's so amazing that we are able to do this in the month of the nurses, the month when we appreciate the nurses. Today is the 7th of May. Actually, we are in the month where we are appreciated, and I'm proud to be one of them. I'm a nurse taught by great teachers, and all we do there in nursing is to try and give life. You will remember when you were introducing me, my journey school of nursing as a new candidate in the year 1995 changed everything. I got to know what nursing is, and I got to know how to really care for myself. And that brought the hope that an individual with sickle cell disease needs. I was able to care for myself. I was able to raise hope for other children, for all the other parents out there. They saw me as an epitome of life, and they were able to get across to me, get information about how do they do this for their own children. Then was when sickle cell anemia was just a new topic. Not many people knew what was happening. Everyone was out seeking for help. But when they saw me, they see somebody that had passed through the same path and could actually help their children. And with that, I'm able to say genetic education and community education is the key to sickle cell anemia eradication and prevention for now. Thank you.
Thank you, Doc. Like, oh God, I am so stoked. I'm so excited to be handling this right now. All right, before we even dive into the real discussion, ladies and gentlemen, this is Tumim NG hosting you all with our very generous and awesome and beautiful madam, our guest today, Dr. Oluwayemisi Olagunju. And Tumim NG is a product of Intelligent Healthcare Solutions. Tumim NG is an online education platform where knowledge experts come to teach, share their knowledge, and students come to grab the knowledge that has been dumped. So you see, it's a meeting point, particularly for healthcare professionals. So you will see different courses really around. You see courses on research, on digital skills, parenting, and of course, Dr. Lagunju's course on sickle cell disease. Really, it's even more than that. She has, oh my God. Okay, I think I will keep that for another time so that I will drop it very well, Dr. Lagunju's topic. Today we are talking about sickle cell disease. I decided to defer your course so that people will just get to know more about your course. Now, let's talk about sickle cell disease. We have some more comments here. We'll bring them up as we move on. But before then, what exactly is sickle cell disease?
Sickle cell disease is a disease that occurs when an individual, especially the newborn, inherits an abnormal hemoglobin from each of the parents, and thus having the two together, the two copies, giving rise to an individual with hemoglobin SS. That is when you talk about sickle cell disease. It is an autosomal recessive condition, and I'm going to bring it to layman's language. When an individual that inherits a copy from the parent father and another copy of the abnormal hemoglobin S from the parent's mother and comes together, they give birth to that child that will now have hemoglobin SS. Actually, people call it sickle cell disease when the two copies are inside one person. But there are variations with sickle cell anemia. You will agree with me that anemia is just like an household name that tells you that insufficient blood supply in the body. So when you talk about sickle cell anemia, we have different variations. So when you are talking about hemoglobin SC, some individual will come to you and say, I've gone to the lab, the doctor tells me that I'm not hemoglobin SS, but I'm hemoglobin SC. It's also a variant of sickle cell anemia. The individual too will have issues with sufficient blood in the body. Another variant is that of hemoglobin SB. Knowledgeable people call it beta thalassemia. You will hear of hemoglobin SO. You will hear of hemoglobin SE. You will hear of hemoglobin AS. You remember from our misconception, we say, I'm AS, I'm safe. He also has that hemoglobin S that makes that blood too to be prone to anemia once in a while. Then the main notified one in that group is hemoglobin SS disease, when the two copies are present in an individual. And when you hear people talk about sickle cell disease, we have stigmatized it to the extent that the layman outside there know what sickle cell disease is. They will tell sickler, they will tell you the people that die early. But when you hear the word sickle, you will remember that as farmers, people that work in the farm, when you talk about sickle, it's just a tool with which they harvest some of the products. And when you hear of the word sickle, it must be like a shape of C, not complete round like what the normal red blood cell should be. That is where the name comes from, sickle cell anemia. Anemia that results because the red blood cell's shape is being altered, making it to be sickle instead of round. Are we together? So when we're talking about sickle cell anemia, we are talking about that disease that comes up because an individual got a copy of abnormal hemoglobin S from both parents, given her the two copies that now make her to be prone to different symptoms or complications that arise from when blood does not flow properly in the blood vessels, because everybody knows that blood is life. It is the red blood cells that carries the oxygen that all the cells of the body will need to thrive. So when the red blood cells is now not healthy, is not capable to carry that oxygen that is needed for the eyes to see, for the brain to think, for the mouth to function, for the legs, you will now see that the individual will not thrive normally. Instead of reaching all milestones, he or she may not be able to do that. And when you talk about sickle cell anemia, it comes to limelight when the newborn has reached age 6 months. Why? That is when the individual baby has exhausted all the hemoglobin that is called fetal hemoglobin that are normal, that is born with. The body is trying to generate its own the body is trying to generate its own hemoglobin from that marrow that has had abnormal hemoglobin. That is when you will now notice that this is not the baby I ought to has swollen leg, swollen foot, swollen hands, and that is when the parent actually swings into action.
That has been a very passionate presentation. Really a passionate one. We just threw up the question, what is sickle cell disease? And boom, knowledge is flowing. Everything is flowing. Dr. Laguju, while we were talking, we had so many comments coming up here and there. And of course, there are certain terms you mentioned while you were calling and explaining what you're saying. For example, you mentioned fetal hemoglobin, you mentioned autosomal recessive inheritance. Now, we'll still talk about that because we want to assume that the audience you have today are non-health inclined, and they are like, what is Dr. Lagun just saying today? What is autosomal recessive? What is fetal hemoglobin again? How can we even marry this thing into the whole sickle cell disease, whatever we are discussing? We are certainly going to continue from there. But let's just check out other comments that flew in while you were talking. Fumilaya said, Dr. Lagunju is good-hearted person. Love her. Thank you. Russia said, well done, ma. Adenike, Yemisi, it's nice having your live chat. Thanks for the comments. Patience, I'm happy to be here. We're happy to have you too. Badaronke, good to be here. Oh, thanks for that comment. Then Paulina said, Dr. Olagunju, in brackets, survivor, an emphasis on that. Welcome to share your life experiences. I am very grateful to hear from you. And then we have John say, good to be here. Oh, we are happy to have you. Then we have Titi. Titi said, happy to be here. Then Nora. We are proud of you, Yemisi. You're a role model. Thank you. Well done, Dr. Lagunju. I'm so proud to be here. Thank you, Abanom. This is interesting. Brilliant presentation. Hire you, DSCs. Thank you, Grace. And Adetokumbo said, always proud of you. Thank you. Then we have Slicky. Okay. Then, we have Messi and Lightning. Thanks. We are happy to see that. I'm proud of you, Dr. Oluwayemisi. This is such a great day to be having all these things here. Margaret said this is so enlightening. Thanks. And we have Afolabi. Congratulations, Doc. Proud of you. Oh, it is all raining. Congratulations. I'm proud. Like, this is just amazing. We have Anita Lukong. Nice presentation. And Olagunju again. Love you, Ma. Thank you. Then, am I missing anyone? Well done, dear Ma. So detailed. Thanks, Adriel. And then we have Rolake, very well enlightening. Well done, Dr. Oluwayemisi. I'm proud of you. And the last one, Dominic Oyemechi. Dr. Olagunju, please, ma, be breaking most of the medical jargon to a layman's understanding. Mm. So that brings us back to autosomal recessive and fetal hemoglobin. I think we can take it from there. Maybe you can explain to your audience what autosomal recessive is and then exactly what fetal hemoglobin is.
Thank you. Okay, when we're talking about sickle cell disease, the point here is that copy of hemoglobin S that is inherited from each parent is actually not from the sex hormone. You know, we just assume everyone has this knowledge of basic biology. We have cells in the body, we have chromosomes, we have components of those cells. But the details, the codes that shows who you will be, whether you will be fair, whether you will be dark, whether you will be this, is already cloned into your gene. And we will talk about the body having different chromosomes. We have the sex chromosomes that determine whether the baby will be a male or a female. But the chromosome affected for a baby to have hemoglobin SS is that not of the sex chromosome. It does not tell you that immediately somebody will have hemoglobin SS, the person should be a male. No, it is one of the 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 chromosomes, the things that gives you the code that generates who you will be, is one of them that carries that makes that mutation, that abnormality, to be seen as hemoglobin S. The normal the normal code on that string should have glutamine. But when it comes to hemoglobin S, because it is an aberration, it is a mutation, it will now be changed to valine, VALINE. People call it valine, whatever. For the hemoglobin C, that will be changed to lysine. They are still jargons. So let's just go back to this. That individual, I want you to help me project that talks about genetic inheritance. That individual man and the individual woman comes together, getting married, they are now interested in raising children. But before then, maybe they are not aware of their own genotype. we are we've all heard from the media that we have people with genotype AA, people with genotype AS, people with genotype SS, that the people we're talking about today, people with sickle cell disease, people with genotype SC. When an individual with genotype AS man get married to an individual with genotype AS woman and they are interested in giving birth to babies, at that point they come together, they must exchange um their chromosomes in that baby. The baby takes from the mother and takes from the father. For what you are seeing being displayed, for every pregnancy, that lucky parents have the grace of having children with AA, AS, AS, or SS. Those are the four variations of hemoglobin genotype that baby that will be given birth to can have. The baby can have AA genotype, he or she can come with AS genotype. That AS genotype is 50% chance. That means for that pregnancy, the chance that the baby will be AS is higher than the chance that the baby will be AA. Are we getting it? And you remember when I talked about sickle cell anemia, somebody with genotype AS has a copy of the sickling S, but because of the copy of the A that neutralize whatever be the effect of that of S, the person may not be coming down with pain, the person may not have pronounced anemia, but he can still have it. But there is also a 25% chance that that same pregnancy can result into a child with genotype SS. So the misconception before now is that If an individual with AS marries an individual with AS, it's until they give birth to their fourth child that they will get a person with genotype SS. It's a lie. That individual can give birth to 6 children that will all be genotype SS, people with sickle cell disease. That individual, those individual, the two of them, AS coming together, can give birth to children that will be all AA. But you will agree with me, the way the dice is cast anytime, you can't be sure this is what will happen. So you will have more of it prone to giving birth to a child with genotype SS than with a child with genotype AA. Close to it, you will see another couple. The person with genotype AA getting married to the person with genotype AS. They will never give birth to a child with sickle cell disease. But they too, with one way or the other, still contribute to that sickle anemia. They will give birth to children with the traits. So they are prone to give birth to children with AS, AS, AA, AA, and for each pregnancy, they have 50% chances of giving birth to either AA or AS. So that child with genotype AS just got to be cautious because she has that sickling hemoglobin S, that with any copulation with another individual that is not aware of his genotype, whether it's AS or SS, can actually produce a child with sickle cell disease. So you now agree with me where the burden lies. How many people in the community actually knows their genotype? Even at the point of giving going to the altar, some churches will ask you to go and do your genotype. Couples in love will still go ahead and lie. They will submit AA, get a stamp from nowhere, but it's because of the ignorance. If you have AS and AS coming together, there is more chances that they will have a child with sickle cell disease. Actually, in the real world, we've met people with AS coming together and they never had any child with AA. Whereas the science tells us that they still have 25% with each pregnancy to have AA. Why is it that it is the 25% to have SS that came to play with them? I have a family recently. The child is in GSS 1 and she still has siblings with sickle cell disease. And the story is always, I did not know. So the purpose of today's interview is to promote the education about genetic inheritance and the grace and the opportunity for everyone out there that is yet to get married to go for their genotype test in an acclaimed hospital certified by the federal government to practice, that is accredited. Because it will interest you to know that when I went for my test in a private hospital in Lagos, I was given AA, and I confronted them immediately that this is not the first time I'm doing this. I'm actually HBSS. The person actually said that was what she got. So you need to go do your genotype. That is the normal layman's term that we all understand. For the hematologists, they will tell you that it is actually the phenotype. But go there to the hospital, check your genotype, check that of your children, let them know early and let them have the education about what genetic inheritance is. It may not only be about sickle cell disease. There are other diseases out there that your knowledge of genetics will actually assist you to live long. Thank you.
Thank you, Doc. Thank you for your in-depth. Like I like the way you just give in-depth explanation. One thing leads into another, and we are just having so many discussions. Now, I think the next phase we'll enter after going through the comment section is really about that thing of treating stroke if it can be cured, because somehow the mainstream media have heard one way or the other about sickle cell, just that some people may not completely know how it is inherited. Fine. But there is this new flair everywhere. How can we treat? I heard when the lady is still pregnant, we can do something about that. All those kind of stories about prenatal and the rest. So that's the next phase we'll be entering when we go through the various comments here. Ogechi said, well done, good to be here. Thank you, Ogechi, for joining in. Yetunde said, I'm always so proud of you, my darling sister and mentor, Auntie Yemisi. Thank you, Yetunde. Fakwa John, much love from XS UK. So proud of your achievements. Thank you all for joining in and listening. And we have Victoria Deshina. Thanks for the presentation. We are proud of you. Thank you for joining in. We have Fumilayo. I am Oh, well, let me put it something there. I am proud of you, a real survivor. And then we have
That's my mom.
Adetokunbo. Oh, great. I have to go and put that back. So I was right with what I put in. Yes, this is Ma Fumilayo Ajayi that gave birth to Dr. Oluwayemisi Olagunju. Okay, then we have Adetokunbo. That's my own Dr. Oluwayemisi. You a living testimony. Thank you. Then this looks like a question from Oluwabwenga. Is it possible to look for traditional solutions such as use of vegetables and herbs? So we'll come back to this. We'll definitely address this. Let me just go through every other comment and you take this question even before we walk into the other phase proper or maybe alongside. Then Adewi said, thanks for this presentation. We are proud of you. Thanks for joining in. Okay, the same comment. And we have Abimbola. Well done, Doc. Greater exploits, Ma. And we have Oyepeju. We are proud of you, Ma. We are proud of you, Ma. Well done. Okay, and Abimbola again. Well done, Ma. Okay. Oluwaboyinga, the same question. Is it possible to look for a traditional or indigenous solution? Okay, we'll attend to your question, certainly. Leke Adamola, congratulations, Dr. Olagunju. You made us very proud. Thanks. And a follow-up message said this is from Professor Afolai. All right, then we have Ademidun. Well done, Ma. Today is really a day of accolades. We have Grace. Happy to be here. I congratulate you, Dr. Lagunju. Happy bat. Well done, Ma. This is a detailed presentation. And then we have Fola Shade. Well done, Dr. Lagunju. So proud to be a nurse. Yes, once again, Happy Nurses Day to every nurse who is with us here and those who will still watch this video after this session. We are all proud of what you do. We are proud of you all. We are proud of your contributions to our society. And we are happy to have you here. And then the next, okay, now this is another question from Abimbola. So we have two questions from the comment section, which I would definitely highlight, but I'll read it up now. Thank you for the enlightenment, Dr. Yemisi. My question, with IVF, can the chromosomes choice be manipulated for AS couple? So that's the second question. Then we have Abanom said, Dr. Lagunji, your lecture is interesting and detailed. And we have, Boshe said, Omotosho, thank you for your enlightening talk, Ma. Thank you for joining. We have Shola. Well done, Dr. Lagunju. Oh, great. Grace said, I'm proud of you. Thanks for the courage and encouraging presentation. Greater heights. Teresa said, information is power. Thank you for the enlightenment, my great superior. Thanks for joining in. Okay, Oluwatimi Lehin said, well done, Dr. Lagunju. Eko. Okay, thanks for joining in. Kolaole, really keen about the possibility of knowing the genotype from pregnancy and legality of termination. We have three now, so we are taking counts to make sure we don't really miss out on any question. Ladies and gentlemen, remember you can drop your questions, your comments down there in the comment section, and trust me, Dr. STM, to definitely bring this up for Dr. Oluwayemisi to see. And the discussion we are certainly having, just in case you're joining us, is Can sickle cell really be treated? Right. Tijani said, congratulations, Dr. Lagunju, on this expository program on sickle cell disease, I assume. Then Love said, thumb up, Dr. Olagunju. Keep soaring high. And okay, we have Kolawole came in a bit late. Don't worry, you will definitely keep up with the flow. All right, we have sorry, Fumilaya said, oh, thanks for the presentation, ma. I'm disturbed when I see health professionals having children with hemoglobin SS when they are supposed to be knowledgeable on this and be able to counsel couples on this. Now, these are the issues. Okay, then we have Fasiku Boshide. Well done, doctor. Oh, you all are really going to outrow me today. Oyevipe said, congratulations, doctor. You're a living testimony. And Mobolaji, well done, Dr. Lagunju. We are proud of you, ma. Shekinat said, excellent presentation, Dr. Lagunju. And we now have Asiru. Thanks for the presentation, Dr. Olagunju. Thanks, ladies and gentlemen, for joining in. We are really, really happy to have you here. This program is brought to you by Tumim NG, and with you, the host today is Dr. Ifnaya Stella Maris Ayanwo. I'm commonly known as Dr. STM. And our lovely guest, all of you already know, is Dr. Oluwayemisi Olagunju, a sickle cell disease survivor, as she likes to call herself, a special child. And she's the one taking this thing for us today, not just as a sickle cell survivor, but equally as a nurse. And in that particular the same juncture, I'm going to bring in the fact that Dr. Oluwayemisi also has a course with us here in Tumim NG. Her course is about promoting patient care and is particularly important for healthcare professionals. Now, once again, I have to reiterate that Tumim NG is an online education platform mainly for healthcare professionals, even though non-healthcare professionals can come and learn. So it is a platform where knowledge experts come and teach, and of course, students come and learn. You alone can be both a student and a teacher. That's the amazing thing there. So you can teach, you can drop your knowledge, and of course, get fulfilled with sharing your knowledge and the returns that come from it. Dr. Luwayemisi already has hers. She knows what we are talking about already, where she gave us the course on promoting patient care. So you can see that the knowledge you have, you can put it up for people to learn. Just in case you're wondering what the outline within Dr. Lagunjo's course. Now the course will tell you things about the theory of patient care, the promotion of patient care, the theory of nursing systems, the roles of nurses, and will now cement all these things with a case study. Dr. Lagunju, you are really, really a great gem, and we are so proud of you. We are happy to have you here. Ladies and gentlemen, thank you again for joining in. Now we'll be taking the questions from the comment section one by one. So, Dr. Lagunju, you have Oluwa Bwenga asking, is it possible to look for traditional solutions such as the use of vegetables and herbs?
Thank you. Before we go there, you remember I talked about the diagnosis is usually noticeable in a child by 6 months. So how do you even treat a child that you don't know what is wrong with? So I will tell you that when you have a child that is always crying, that is irritable, the first thing is to take the child to the hospital for you to get the correct diagnosis. There are different diseases that can just come up in childhood, and it is not good for you to be guessing what is wrong with your child. Take the child to the hospital for the child to have appropriate diagnosis. And I'm sure that at that point, the medical practitioner will talk about screening. And at the point of screening, you will be given counseling. It is called genetic counseling. To prepare you intellectually, to make you be ready for whatever the result will be. And when the result is out, you will still be put through another set of counseling that we ensure that you understood whatever is said in the hospital as of the time you took the child. So now the child had been diagnosed and the child is now with you. At that point, the medical practitioner will tell you what to do to assist you. I would not doubt the fact that people talked about apps and local therapies in treating just any diseases. You will agree with me that they have a body that should certify which drug should be taken and for which dosage. But you will also agree with me that at the point that you are sick or you are caring for a sick person, we are not talking of somebody that got headache and gut reliefs. No, we are talking about being sick continuously. A child that has sickle cell disease in the rainy season will actually be down most of the time, depending on the degree of severity of the sickle cell disease. So at this point, as a caregiver, you will not be at the position to think through your options. You will actually be looking for solution at any point, anywhere. And that makes you vulnerable to people that really want to cajole you into using your hard-earned money to buy apps that had not been tested, that had not been proven. I will not discourage the use of traditional solution, but then use it with an advice from a learned medical practitioner. You will see people that had come up, a trained medical practitioner, but is also trained in traditional apps, will tell you this is the dosage of this is what we do with this. But by the time you lock the child at home and you are doing self-medication, someone comes to you, grounded something and said this is for sickle cell. Another one, because you are not a scientist, you cannot test the potency. You cannot even affirm whether it is the right thing it's giving you. To be sure you are not giving poison to that child, take the child to the hospital. The time we are now, we have better options. A lot of medical practitioners are now aware of what sickle cell disease is, and they know what to be done for prevention of complication and how to treat the child. So it is always good to take the child to the hospital. When you get the child to the hospital, you will get advice on which traditional solution, if any, that had not been put into tablets will be allowed for that your child. Are we together? So to the question, what do you use to treat sickle cell disease? This goes to people that already have children diagnosed with sickle cell disease. At this point, whether you go for genetic testing or you don't go for genetic testing, the child had been diagnosed. So we need to help the child. The first thing is the caregiver should seek for knowledge, education. Go to the clinic with the child. The medical practitioner in those clinics will enlighten you on hydration. Hydration. The slogan is drink like a fish. Because you remember, the normal cells should be circle so that we pass through the tube, the blood vessels easily with no itch. The child blood is now sickle. As he's moving, he's getting stopped up. As he's moving, he's coagulating that area, he's stopping the flow of other blood. The oxygen can't reach where it's supposed to go. The one that is coming can't pass. The person starts feeling pain. Oxygen has been reduced to the vital organs. So the pain, where if the blood is arrested by the joints, the place becomes swollen. The pain there is unfathomable. You can't describe it. People will say bad pain. Bad pain will come, it will go. Sickle cell pain comes and recur. So at that point, you educate the mother or the child to keep taking water, hydration, keep drinking, keep drinking, keep drinking. When you take water a lot, it help you push all those cells that could be coagulating. But if you waited at home for the child to now have crisis, and she or he has not taken sufficient fluid, what you do is you get the child to the nearest hospital, certified hospital, not where you have quacks. When you get there, different tests will be done, but prior to that, they will put the child on infusion so that enough volume of fluid can be pumped into the system and relieve the child of whatever pain is getting. So hydration, it is always advisable that the individual drinks plenty, enough cups of water. People will say 3,000 mils, and that tells you that you calculate what you drink and you get, if this is 750, that means you are drinking like 5 of this. At the onset, it may not be that easy for the child, but with more encouragement, you can put lime, anything that will just change the taste from ordinary water and makes it into drinkable water. Just encourage the child to keep drinking. Water is life. Then another one is the person must keep to the routine drugs. Because you took the child to the hospital to see a trained medical personnel, the person will be given routine drugs. As a child, ensure that you take the child for his or her complete immunization. All these under 5 immunization, the child must complete his immunization, because you will agree with me, the person is prone to infection. The red blood cells, they die easily. They don't stay till that 120 days for the normal cells. The sickling blood may die as often as within 30 days. And you know your marrows, before it starts producing blood again to circulate the system. So we must guard that the child does not have infection by taking all the immunization and by ensuring personal hygiene. Wash the child's hands regularly. Ensure that he does not pick up, that you say a child is crawling and he picks the CF. No, that is not for a child with sickle cell disease. The environment must be clean. The environment must be clean. And at the point that the individual is taking his routine drugs, which will be mainly folic acid, for people that they will be given Sunday, we call it Sunday medicine. Now it has been daily medicine. It could be Proguanil. As long as the child is taken to the hospital, he will get those drugs. Then the caregiver will be told that when there is slight pain, this is what you use. And for now, we are lucky. For a child that even from 9 months, there is a drug that they call hydroxyurea, and all the variations that is only medical trained personnel that should prescribe that drugs, because the child will blood work will be done, laboratory findings to know the dosage that will be appropriate for that child. And when all these are being given to the caregiver to take for the child, please stick to the routine. Let the child has his or her drugs daily. You remember, hydration is every day, it's not once in a week. Then if there is any form of pain, you report to the hospital. Or if you have been given any pain medication, please give to the child. And remember, balanced diets, we cannot overemphasize it. That child with sickle cell disease, that is why the acronym is, it is a sickness for the rich. No, it is a sickness for the learned, the educated. It's just that you should know the child will need a lot of proteinous diet. For that, parents, they should be show interest. The child is now with us. It's nobody's fault. This is not the time to be sharing blame. No, the child is with us. How will the child strive? How will the child grow? Do we get it? And we are now luckier, because before then, you will not know about your diagnosis until that's around 6 months, when the parents will be worried that the child is crying. Now, it's now with us. Newborn screening. the government, the non-governmental organization, people that are interested in sickle cell disease, they are trying to do all they can to ensure that Nigerian babies too have access to screening within the first few hours of life. And because of our peculiarity in Nigeria, there is an ongoing program everywhere in the southwest, even in the north, to ensure that your child is screened. If you don't screen that child, you will not know the genotype of that child to be able to forestall whatsoever will be the complication. So as a pregnant mother, in your antenatal clinic, inquire from them, newborn screening, how do I get to do this, that my child will be screened within the first 24-48 hours of life. And even for the one for the southwest, it's been extended to all children from 0 to 5 years. Let's screen them, let's know their genotype, let's know how we can help them. With newborn screening that had been with the advanced community for more than 40-60 years, children are picked immediately they were born, to know that okay, this child is with this genotype, and treatment will be started on time so that the child can actually live a pain-free childhood. Do we get it? And for that questions of what are my options, prenatal screening. Prenatal screening has been with the advanced world for more than 60 years, but I know it's coming gradually to us. This is the opportunity for you to screen that fetus for what is that genotype, or what other diseases that the fetus can actually be carrying. But remember, whatever innovation is coming into our vicinity, we have laws that will actually let us know whether this innovation will be accepted or not. Until now, the law still says no to abortion. So whether you get the fetus screened, do we have a law on ground that supports a termination of that pregnancy to ensure that the baby does not come to life? Those are the dilemmas. We want to see, okay, this is advanced world, they are already doing prenatal screening. There are laws that says, okay, if there are congenital abnormalities, if there are this detected in this, the parents have a choice to make whether they want to leave the pregnancy or they want to terminate it. But do we have such in Nigeria? So that is that with prenatal screening. Yes, it's with us. People have opportunity to do the screening. You just ask for it from the hospital that is accredited, government-owned hospital. You will be directed on what to do. But then, do we have that opportunity to pick abortion in any circumstances? Another one for treatment. Here with us, we now talk about stem cell therapy. We talked about a bone marrow transplantation. We have had instances of all those transplantation done successfully in Nigeria, but it is not cheap. It is not cheap, not only in terms of money, but also in terms of the logistic. Before you go for bone marrow transplantation, you should have somebody that is compatible, that is stem cell can actually be used to help the individual with sickle cell disease. So the option with us now is that newborn screening. Identify what is with the child as early as 48 hours and let the child be helped to live a meaningful, pain-free life. Thank you.
Oh, once again, thank you, Dr. Oluwayemisi, for your passionate answers. So we've actually attended to two questions while you were doing this. You attended to the question of using traditional solutions, herbs, and then you equally attended to the question of prenatal screening and legality of termination. And then there was still another question. Thank you for this. She said, with IVF, can the chromosomes choice be manipulated for AS couple?
Thank you for the question, but I want to say I don't have answer for this because I know that with IVF you go through a lot of counseling and you will be told what to do, what not to do. But if you are taking that option, I know that whoever the medical practitioner that is attending to you will actually provide a way out. Because I can't just imagine going through IVF and still come down with a child with hemoglobin SS. Oh, that will be an untold. Let's be silent on that. So please talk to your practitioner. Talk to the medical practitioner you seeing for the IVF. Thank you.
All right, thank you, Dr. Oluwayemisi. So, Abimbola, you've seen the answer to your question. Now we still have, of course, comments, questions coming in. So let's just run through and see. We've had these ones. I think we start from here. Ashira said, thanks for the presentation. Faith said, well done, ma. Thanks for the presentation. And Olatunde, well done, ma, Dr. Olagunju. Then Sekina said, it so happen when love is in action and we throw caution to the winds. I think this particular
She's answering that
comment is
question
for
of
the
how will
medical
medical
professionals.
practitioner be giving birth
Yeah,
to children with
I think
and may
so.
I sound a caution note there. Most time, because we have a lot of laboratories that are not regulated. I have instances of a colleague that she actually, because she knew she was going to marry somebody with hemoglobin SS, the
Ah,
person living with sickle cell disease. So she went to different laboratory to do
wow.
her own genotype. And at all the laboratories she went to, but I don't know why she was just screening out government laboratory. She went to all private laboratory. Three of them gave her AA, and
Oh,
her last born happened to be individual with sickle cell. That was what broke her down because she knew she was going into this union with an individual with sickle cell. So let me be sure that I'm AA. And the laboratory still did the effort of giving her a wrong result. It was at the point that the child was diagnosed that she went back for her own test in the government hospital, and it was confirmed that she was actually AA,
now
genotype AS, sorry. So please,
I'm
when we
trying
are doing
to
our
hold
test,
on.
let's go to government-owned laboratory, certified, accredited, not always the private laboratories. I don't know what is wrong, but for me to do a test in a private laboratory that had been living with sickle cell for more than 28 years before I went for that test, and they still returning AA to me, that means it may be just a propaganda to sell so that at least the laboratory can get more people because of those desperate people that want to present it in church to ensure that at least they give permission for church wedding. It may not be the fault of the people, but the laboratories too. We should please check which laboratories we patronize. Thank you.
This is really disheartening because when you were talking about, I'm trying to wrap my mind around it. The person has done theirs, like they made effort. Is there like a legal consequence for? In fact, I would need, if there are any lab scientists here within the discussion, please, I would like to see your discussion, your interactions about this thing of unreliable lab results. I would really need to know because all these things, the essence of all these discussions is to find chart a way forward. It's not just to come up and throw the problems open and we are not even thinking about solutions. So I think it will be cool to think of a way forward. Now let's also think about is there a way for legal action for these unreliable, the labs that give up the unreliable answers or results? But before then, let's still come up to check out. We have Adebayo saying, thanks for the presentation, Olagunju. Then we have Oluwayemisi, hope there will be question time. The question time is with you. The question time is right here. So please drop it as we are going through. We'll definitely be seeing it. Then we have Victor. Good to be here. Oh, we are happy to have you, Victor. There is a question here. Dominic said, my question is, why is it that some sicklers die before, for instance, 18 years of age, while others live up to 60? Could it be because of their genetic makeup or their lifestyle? That's one question. Another question, who today is a full one. Is it true that giving birth early as a warrior eases pain? That's the second question. All right, we have some of us escape without getting our fingers burnt. I was lucky to have all my three children SS free, despite having an AS partner as myself. Whoa! Real life situation here. Okay, then we have Samuel Ibuku. Nice presentation, ma. Thank you. Then we have this. Dr. Olagoju, can you please shed more light on the uses of hydroxyurea? God, today is a hot one. Dr. Shoyemi, well done, Mas. There is a need to regularly educate more people on this health condition, those affected and their carers too. There is a need for updates on current management to help more people. I agree. Then Shekna said, I'd like Dr. Olagunju to educate us on why some people escape having children who are SS when both partners are AS. Ladies and gentlemen, we've spent 1 hour more today. You're dragging this. And Oluwayemisi said, Oluwayemisi, okay, you're calling on your namesake, right? You've not talked on can SS be treated. I can see you have a white eye. How can SS people achieve that too? Oh, so it's also another question. How can SS people achieve a white eye? Okay, great. Then I'm checking. Second, I said, I would also encourage healthcare professionals, healthcare practitioners to take this message of awareness about sickle cell to the public, encourage premarital counseling, encourage people living with SS to seek medical services. Okay, that's fine. And we have joint sickle cell clubs. Okay, I think it's a continuation about that. And then she now said, thank you, ma. Hydration is key. Thanks. Oh, okay, this is becoming really interesting. Paula Sede said, I used to think sickle cell is best prevented rather than treatment. Okay, well, if I'm to think about that, I would think the prevention is mainly about knowing your genotype before marriage, isn't it? And then we have this from Fumilayo. Please, do we have a non-governmental organization working to assist family that have three children with sickle cell? I know a family that needs support, any form to cope with the burdens of this condition. Oh, all right. Please expatiate on how to prevent sickle cell crisis among this group of patients. I think that was the part she mentioned about hydration and compliance to your routine drugs. If I'm right, Dr. Lagunju.
Yes, yes.
Okay, so then we have Abimbola saying thanks for the enlightenment. Faith, ma, I would like to ask if sickle cell patients can take COVID vaccine. Wow, so many interesting
Yes,
questions coming up here, and I will stop with this. Olaide Edet's comments. Well done for this presentation. So I will
that's a
go back
good
to check up
question.
all the questions. I will go this time retrospective so that we can attend to them and not miss out. So let's start with, can sickle cell patients take COVID vaccine?
Yes, I joined the Global Alliance for Sickle Cell. Is a platform where people all over the world that have interest in sickle cell disease come together and they share experiences. We have a lot of professors, carer, doctors, all people that are interested with sickle cell disease. And when COVID-19 came, a lot of information was shared on the platform. When the vaccine was like being made mandatory, we now got people in their domain, people in Canada, people in UK, US. They went ahead and they had COVID vaccine, and they were followed up. and the report was that there is no restriction to taking COVID vaccine in people with sickle cell disease. That actually it protects rather than giving any complication with people that had taken the vaccine over time and that had been monitored. So I went ahead and I took my 2 doses, and I had no complication. So I don't think it's restricted in people with sickle cell disease, because we all know that infection in sickle cell disease can be actually deadly. So it's always good to protect us against any form of infection. So no restriction on COVID vaccine for people with sickle cell disease as of today.
All right. Thank you, Doc. Excuse me. Then we have, do we have any NGO assisting families? I think we just have to be giving it brief answers so that we can accommodate the
Yes,
questions.
yes, the individual should speak up. The individual should speak up in the sense that when the person takes the affected children to the hospital, talk to the hematologist in that environment. I know in my environment here, there are NGOs that assist individual with sickle cell disease. And that brings me to this fact. Sickle cell disease had been stigmatized for long, so people find it difficult to come out. You will have a parent with sickle cell children will be hiding the children inside the house. When you are not a doctor, when you are not a nurse, and you are not a medical practitioner, even if you are a nurse, if you are a doctor, do you manufacture those drugs in your house? When the child needs transfusion, do you get the blood in your house? Speak up. It's just like taking malaria to the hospital. Let's get out this misconception. It is God that reigns in the affairs of any human being. Somebody asked the question, why do some people live to age 60 while others die at age 18 with sickle cell disease? Has it occurred to you, the people that die, are they only people with sickle cell disease? Haven't you seen an individual with genotype AA dying? Don't stigmatize death with any classes of genotype. It is just you living your life. The fear alone prevents both parents and even the children from coming out to seek help. The stigmatization had done enough in our environment. The education now is prevent sickle cell disease. Don't marry wrong. Go for your genotype. Let the children know their genotype so that they are enlightened from childhood. Let them know the implication of incompatibility with sickle cell disease, and let everybody make informed choices. When you now have children with sickle cell disease, let there be screening. Screen the children early so that they can have access to care early. And for the parents, make up your mind. You are the carer. Until the child is 14, 15, he or she cannot do anything meaningful. It is the parent that decide. There is change in the temperature. Let me wear more clothes for the child to keep her warm. Let me take the child for immunization. Let me prepare food that will help the child. Lifestyle is key. Reduce stress in any ramification. That child is not the one you will put into a house that has no mosquito net on the window. No, it is a disease that needs education and money. Make sure the child is exposed to conducive environment at all fronts. It is not for the child to be drinking garri in the afternoon, drinking garri at night. She won't survive. The child needs basic nutrition. The child needs balanced diet. The child needs more than what you're giving to the other children. Their own body can actually say, okay, bone marrow is producing this white blood cells, it is fighting this disease. You need to supplement with a lot of food, and let it be food. Don't spend your money on drugs that had not been tested. People will come to you with a lot of information. Weigh it and assess help in the with the medical practitioner that had been trained and learned. They learn what to do with it, and they can actually help you. The money for food, don't spend it on, okay, this organic material, stem cell products. No, it has not been proven. Eat well. Let the child attend his clinic regularly. Hydration can never be overemphasized. Drink water. Because you are the carer, the child will imitate what you are doing. If you are drinking only 200 mils per day, you can't preach to a child to drink 2000 mils. So leave what you want the child to be. And as the child is growing, let her know that she's not doomed to have a hemoglobin SS. It is God that designed individual. Let her live her life. Don't shield her from everything. Let her live. By living, she will learn. There are times my parents will say, don't do this. I'll go ahead and do it. Do the exercise. People are happy around me. When the next day I'll be crying for pain, nobody will tell me not to do it again. But immediately you are shielding her, it's a form of emotional stigmatization, psychological stigmatization. This, no, let's carry the information out there. They are individual like ordinary people, but they are special because they can't withstand stress, they can't withstand infection, and they need knowledge to live long. Thank you.
Thank you, Doc. Thank you. Passionate answer once again. I'm looking for the questions that we've not addressed because as you're answering some questions, you're also answering others. For example,
I'm trying to
where
take the
um
time.
yeah, this person said, can you talk on okay, you've not talked on can SS be treated? I think we talked about that.
And we can still repeat it. Sickle cell disease can be treated. Can be treated. People that the treatment now is bone marrow transplantation. And in the advanced world, they have talked about gene therapy. But the most recent one that came up, they are still working on it because one of their trial patients actually came down with leukemia, because with gene therapy they subjected those people to chemotherapy, and we know what chemotherapy is. It lowers the immune system, it kills some body cells, and some of the experimental participants actually came down with the complications of the therapy. So but for all the treatment, it is money. So it's prevention is better than thinking about cure.
Cure.
And for the prevention of sickle cell disease, genetic education. It will interest you to note that people of my age still do not know what genotype is all about. They still do not know what compatibility is all about. Please spread the news. Let people be aware of their genotype. Let them make informed choices. Then people that are in already, let all your babies be screened at birth.
Okay. Oh, thank you. It's been a please let's give our guest some time for water break. She's been talking, talking, talking. Okay. Your namesake is still has a follow-up question that said, how did you get a white eye? I don't know why this is quite particular. It's funny. So I can see you have a white eye. How can sickle cell people achieve that too? Then
The
when we are done
secret
with
is water. The secret is water. When I was younger, for my secondary school days, my primary school days, you don't need anyone to tell you that I'm living with sickle cell. My teachers, whether in ignorance, they will say, hey, you better don't touch her, you better don't do this, you better do, because I was fragile. My eyeball is always my conjunctivitis is always yellow. I had not seen the secret of taking water. I'm always thinking you are punishing me. But immediately I entered school of nursing, that changed everything. That is why I'm saying once again, I appreciate all nurses in my life. My teachers, my nurse that was always coming home to hydrate me, Mrs. Odefila, I appreciate you. For all nurses that has picked me up, educated me, and got my back. For all my colleagues, they knew and they still know it when it is time to say, yeah, Mrs. Stop working, because there is nothing you can do when stress creeps in, your immunity gets lowered, then you may be predisposed to crisis. But since I got to school of nursing, I drink water. I drink water. People will even be asking me, are you not going to be intoxicated? I said it's better than having crisis. So water
Crisis.
is the secret of clear conjunctivitis. Educate anyone living with sickle cell disease to drink. Keep drinking. Thank you.
We should probably frame this. Water is the secret to clear conjunctivitis. Dr. Oluwayemisi Olagunju. Go and make this
Thank
and
you.
frame this. Then we have this question. Can you please shed light on the uses of hydroxyurea?
Yes, hydroxyurea. We did a study that says like 10 years usage in a teaching hospital in Nigeria here, and the outcome is so great. Hydroxyurea has been found to be a drug that actually assists an individual living with sickle cell disease to produce more hemoglobin that resembles that of your hemoglobin well when the person is still a fetus. They call it hemoglobin F, F for fetus, the baby in the womb. So because that hemoglobin F has been seen that it will not allow for sickling, so that drugs try to imitate to help your cell to produce more of that hemoglobin, healthy hemoglobin F. So the person that is on that hydroxyurea really comes down with a crisis. But the person has to be under a medical care in an accredited hospital. Why? Like every other drug, you need the person's blood work will need to be done. A lot of tests will be done to actually ascertain which dose will be appropriate to put that individual on. It is not over the counter drug that as a parent, oh, I heard of this drug, let me go and buy and keep giving my child. Or okay, my friend's child too also is on hydroxyurea, I can get from her and be giving my child. No, you need to go to the hospital because you will be doing routine tests as the child is on that drug to be sure whether the dosage will be lowered or the dosage will be increased, to be so that it will not the child will not suffer from the complication that could arise from that drug. So hydroxyurea is the drug and it's available and it's accessible, but you need to go to the hematology clinic of an accredited government hospital where you will be sure you are being attended to by a trained personnel and not quack. You know Nigeria will portray a lot of quack as trained personnel. Please go to the right quarter. And it is not even prohibited in children. A child from 9 months old can start it, and it has always been seen to give good outcome. It reverses all these complication of retarded growth. It reduces free period. So I will encourage anyone with a child with sickle cell disease to please ensure you go to clinic regularly. That is where you get the most current information on treatment, and your child will be appropriately handled. Thank you.
Thank you. Then, is it true that giving birth early as a warrior eases the pain?
From my knowledge, you have an individual living with sickle cell disease that get the red blood cells being destroyed within 30 days. There is issue with anemia. When the person is pregnant, the child relies on the mother for everything. So that is an extra stress on itself, on the health of that mother, whether it is done at early period, whether it is done at late period. Remember that individual still has hemoglobin SS and he has challenge with anemia. So the person need the pregnant woman with genotype SS needs to be registered in a certified hospital under a trained personnel to actually get help. And you will agree with me with the population. Child spacing is always preached, and even family planning option is always preached because you don't want to expose yourself to stress more than what your body can handle. But I don't know about that misconception of maybe at age 18 or 20 somebody should go ahead and get pregnant and give birth. I'm not aware, but I'm sure that even when the person is pregnant, you will be given the option of cesarean section so that you won't keep stressing your system to the point of no return.
All right. Thank you very much for taking those questions. I think this will be our last batch. Yeah, and when we take up
Thank you.
this last batch, we'll call it a day. But before then, ladies and gentlemen, gentle ladies and men, any other permutation, thank you for joining us today. It's been a wonderful 80 minutes plus having this discussion on sickle cell disease. And we are live here with a sickle cell survivor, a wonderful nurse, a special child, like she always called herself, Dr. Oluwa Yemisi Olagunju. She is even modeling what she has been screaming here. Drink water, drink water. Water is the secret to clear conjunctivitis. Dr. Oluwayemisi Olagunju at Tumim NG, 7th May 2022. Now, just in case you're still wondering, Tumim NG is an online education platform for, is owned by Intelligent Healthcare Solutions. Now, this platform is mainly for healthcare professionals. So you have knowledge experts come to teach, and you have students come to learn. One individual can teach and also be a student for another course. So we have many things there. And even Dr. Oluwayemisi, that is speaking to you today, has a course on promoting patient care. Now, her course is basically about the theory of patient care, the promotion of patient care, the theory of nursing systems, and the roles of nurses, while using a case study to drive home this message. Now, we are celebrating the nurses, and all over the world, we are saluting and proud of you, all nurses. Now, just in case you're wondering, how can you get this course or how can you contact us? To begin with, you can see the text scrolling there. Please subscribe and turn on notifications for future content. Yes, because we have more and more of these interviews coming out. And you can check out our website there to tumimng.com. Then you can also contact the number there or send email. So we have several contacts channels that you can reach us, maybe for you to create a course, or you want to take a course, or you want to buy Dr. Oluwayemisi's course. You can as well just browse through our website and see what we have. So these are the things, these are the challenges, these are the discussions. Our own is to use education as a tool on bringing out, shedding out light on so many healthcare issues like we are doing today. And then we'll continue with the remaining comments. Okay, we've answered this question. So we continue from here that Deborah said, quite enlightening. Thank you, Deborah. And we have Adeshola said, Dr. Lagunju, how will you expand? Oh, I think, yes, this is your teacher. I think I recall that. So she said, how will you expand on creating awareness on this in the community? You are a living testimony. People will listen to you more. I think she's doing that like it's one step, one journey after the other. And these things create a ripple effect where one action grows out. So the more, like we've heard today, we are now Dr. Olagunju's disciples. We are supposed to spread the message that water, water, like if you've not learned anything today, you must have learned water, even if you don't learn every other thing. But maybe she could still take the question. Let's quickly run down through the remaining comments. Victoria Deshna, great, I like this. She said, comprehensive newborn screening program for sickle cell disease is available at Obafemi Awolowo University Teaching Hospital Complex in Ile-Ife. It serves the 6 southwestern states. So please, if you know elsewhere, we can drop it here. These are the ways. For example, Southeast, you have it at University of Nigerian Teaching Hospital. So if you know places that can do these particular services, you can also put it out here. The goal is to get this message drumming into the ears of the public. Now, Toyin said, So enlightening. Well done, ma. Esther, in my opinion, mass enlightenment will be a very potent tool to cure. Education should start from primary schools where possible, I guess. This is nice. That's nice. Then Afolabi said, great job, Dr. Lagunju. Dunke said, glad to be connected. We are happy to have you. Abimbala, well done, doctor. Thanks for broadening our knowledge on this. It's quite enlightening. Okay, Oje Rebecca, we see your name. Thank you. And we have Folashade. Thank you, Ma, for comprehensive presentation. Thank you for joining in. Dorcas is quite glad to be here. Oh, great. Thank you. Okay, Rebecca is now saying, how much is the comprehensive neonatal screening? I think I saw the answer somewhere there, so we'll continue with that. I'll definitely get to the answer. Then Teresa said, I'm glad I joined. Thanks so much, Ma, for the wonderful presentation. And Dominic, well done, host, for painstakingly going through all the comments in the comment section. Ah, an accolade for me, finally. All right. Ibukun said, very enlightening, glad to be here. And then we have Sakiru said, is it possible to change the genotype at fetal status in advanced countries? Oh, okay. I won't lay a comment here. I'll leave it for our guests to answer this. And Paulina said, bravo to both of you on this eye-opening presentation. Stay and work safely. Thank you, Paulina. Then Michael said, thanks so much for the presentation. Thank you. Victoria, wash hands. I guess she wants to clap. Thank you too. And Tijani, honestly, there is need to bring in someone like Dr. Lagunju to educate the masses on sickle cell disease in larger societies where non-educated folks would have opportunity to ask questions. I agree, true. So we should be doing more of this, apparently. Great. Then we have Folashade. But that will be therapeutic abortion. I think it should be legalized. So I think she's still talking in terms of terminating on prenatal diagnosis, which is a valid discussion. Like it appears that we'll have to reschedule a different discussion for this termination thing, and we'll get you and even possibly hunt for policymakers to discuss about around this on therapeutic abortion. Okay, then we have Faith. Ibinha. Okay, yes, ma. I agree with this. A lot of unregulated laboratories. My sister was given genotype AA when she was 6 years old. She had a major crisis. We thought it was normal sickness. Oh, sorry about that. Then it was that time that they discovered that she is sickle cell. You can imagine. Sorry about that, please. Then we have Alabi. Thanks for this educative and detailed presentation, Matt. Thank you for joining in. Victoria, good. So the person that asked about the cost of comprehensive newborn screening, you have your answer here. It is 2,500 naira per baby or per test. And I think Victoria is talking with reference to Obafemi Awolowo Teaching Hospital Complex that she posted. So maybe if there is a different price, Dr. Lagunju will let us know. And then we have Esther saying that massive enlightenment is essential to promote cure for sickle cell disease. Education from primary level of education is vital before a person becomes mature enough to fall in love. Someone say, should we kiss and tell or tell and kiss? Tell in this case is about, hey, I am Dr. STM and I am genotype AA before we start falling in love? Or should we fall in love? I am Dr. STM, you fall in love before you now tell the genotype. I think these are the issues around that particular discussion. Now, we have this one that said, wonderful presentation, ma. Please, how do women with sickle cell manage pregnancy, ma? Oh, questions. Okay. Then Esther says she has required information on what his or her genotype is and what children with sickle cell disease go through, especially when in crisis. I'm not sure I get if this is a question or comment. Please, you may have to rephrase and put it down. Then Arai said, well done, madam. Thank you. Trying to go through everything to be sure we did not miss anyone, and then we'll fly through our questions as usual. Then Lucy said, thanks for this wonderful presentation, Dr. Lagunju. Thank you too for joining in. We have Adeni. Thank you, Dr. Lagunju, for this educative lecture. Fumilayo is clapping for us. Thank you. And Tijani said, SCD, please. Okay, I think in correction to SSD. Then Akinto said, well done, Dr. Lagunju. This is really enlightening. Thank you. Adeni, please can we have the soft copy of this lecture? This is YouTube. It will always be here. Once you come up, just subscribe to our channel. Once you come up, you will always see it. We are not taking it down. It will always be here. You can always come back to watch it and scroll to wherever, whichever information you're looking for. And then we have Titiola, well done. I am proud of you. Thank you. Then Faith said, well done, ma. This is really enlightening. God. Esther, is there a medium to reach out to people with sickle cell disease in mass? Well, yeah. And then Anita said, I believe she meant clear conjunctiva. Oh, yeah, not clear conjunctivitis. True. Mm. Well done, Doc. Then we have Adewale, please, what can I do for my children who refuse to be drinking water? I have lost three of my children to sickle cell. I am left with three of them. Important question. Okay. Then Rosemary said, thanks for all the enlightenment. Oh, Ido, I have two different results from the same hospital at different time. Government-owned teaching hospital. I try other hospitals and different results. I think we need to do more in this country. These are the issues, really. These are the real issues. Now, Bosede said, well done, Dr. Lagunju. The Lord renew your strength in Jesus' name. Amen. And then Rosemary, thanks a million. Well done. Thank you. Mobolaji, thanks for the discussion, Doc. Thank you. And Rosemary again, thanks, Dr. Oluwayemisi. Thanks for the enlightenment, Ma. Thanks so much for this presentation. Then please, ma, I hope the hydroxyurea is not expensive. Okay,
It's affordable.
then it's affordable. Okay, but I'm sure you will expand more on that. Then, Rosemary, please keep me on your platform. Okay, thank you, Rosemary. You can see all the contact channels. Just pick up anyone, and we'll definitely get to you. Then we have Clara. Well done, ma. Thank you. Ibikunle, thank you for this presentation, ma. You all are really overwhelming me. Toyin, thank you for this elaborate enlightenment. John, well enlightening. Thank you. Thank you for the detailed and enlightening presentation on SCD, Dr. Lagunju. Well done, ma. Thank you, Grace. We have thanks so much, Dr. Lagunju. Thanks, Timothy. Thanks for the enlightenment, ma. Thanks, Bolaji. This, I think we are getting to the end of it. Great. Afolabi, oh, sorry, Buki. How can policymakers be regular engaged in this subject matter? And then, thanks for the enlightenment, ma, by Emmanuel. Dr. Lagunju, well done. I gave birth to three warriors. It's not easy. Oh, the Lord is your strength at all way. And then we now have and this is the last comment here. I think I should give myself accolade. I went through all the comments. Then Omolola said, congratulations, Dr. Lagunju, for
That
being a
is
good
my head
reference
of department,
and role model.
Professor
Oh,
Irioye.
thank you, Irene. Thank you for joining in. We are really happy you joined on for this particular engaging discussion. Okay, Uchenna said, thank you, Doc, for this enlightening presentation. And to you, you are host, you're beautiful. Thank you, sir. So we'll now go back, address our questions. We've been here for 94 minutes talking and fleshing out sickle cell disease. Well, the topic is really worth it. So it's not surprised that we've been having all this time here. So I think when we're done with these questions, we can now call it a day if we don't have much more engaging questions. So we can start with how can policymakers be really engaged in this subject matter?
Thank you. Till now, efforts at ensuring sickle cell disease is prevented and information about sickle cell disease had been politicized. We have different bills that had been sponsored at our assemblies at Abuja there. But the bottom line is everything about Nigeria we use politics to play prank. But we have reliable, trustworthy professionals, professors that are actually interested in ensuring we get to the root of this. But remember, we have human rights. And when you're talking about any legal action, whatever you are doing should not infringe on any human rights. There was a time that it came up, can't we legalize it, that AS should never marry AS? It flops, it never saw the light of the day. But the bottom line and the way forward now, that people that are really interested in ensuring sickle cell disease is eradicated, is that genetic education and newborn screening. People are using their own money to sponsor, to ensure that newborn screening thrives in Nigeria. More than 12 years ago, effort had been made, but you know, with things in Nigeria, politicizing everything, e did not see the light of the day. E didn't run for long before all those equipment got spoilt. But now we have another grace. People are bringing in from non-governmental organizations, collaborating with Obafemi Awolowo University Teaching Hospital and other interested hospitals in the southwest, to ensure that not only do we have diseases diagnosed at birth to be sickle cell disease,
Sorry.
there are other diseases that could be picked. That is why newborn screening is not a new procedure in advanced country. You would have picked, will this child be prone to diabetes, will this child be prone to this, will, from different history, the different cancers that is taking Nigeria are aware. It has already been in that newborn screening specification. But for Nigeria now, we're starting with sickle cell disease. Okay, when people are screened and they get to know their status, we put them on this. They start this therapy, they start this, so that we will ensure that they live longer and meaningful life. Policy makers, if you are still there hearing us, we still need help to ensure that information gets to everyone. It will be right for each state on their own media to be sponsoring education about prevention of sickle cell disease or about treatment every day. I remember when we were growing up, there is an acronym, Abule Oleke Meta. It is an NGO that sponsors that, just to do what? To ensure that they eradicate HIV, to ensure that they give education on sexuality and sex education. We could as well do the same thing and much more. Every media, and I'm happy, all my teachers are here, professors, my supervisees, everyone, we are nurses, we are equipped. In our little corner, let's spread the news. For the person that says she has 3 children, I want to say it's not easy, but it is possible. God will strengthen you. Ensure they don't miss their clinic. Whatever it will take, they will live, and you will enjoy your work. Sickle cell disease is not a joke. It is easier prevented, and it is easier to be managed early. You will have people talking about knee replacement, hip replacement, shoulder replacement. It's not joke. And for Nigeria, you know, people will still go ahead, look for money. And still, we still have a case. He was mismanaged in a government hospital. They treated him as a no person. After spending his hard-earned money, the operation was still not successful. Whatever you can do in your little corner, please put a voice to sickle cell disease eradication. Put a voice to genetic education. Enlighten people out there, your siblings, your nieces, your nephew. Let them know their genotype, and let's carry this together. For the newborn screening, that's just the way out for now. For married people, screen your babies early. Let's rescue them from complication of sickle cell disease. And please, marry right. Love can be blind, but please, sickle cell disease is no joke. The stress is not it. You can't tell of a parent losing his child after a lot of investment to a preventable disease. Please, let's do it together. We can do it. For that, Tolagbe Felicia, you can contact me. I can give you reference to where you need to go and what can work. For the hydroxyurea, it is affordable. It is affordable. It is affordable. It is not expensive. It is affordable. I know that even in Ilesha Teaching Hospital, Obafemi Awolowo Teaching Hospital in Ife here, Ilesha here, for the pediatric population, they've commenced a lot of their clients on it. The only thing is, it is not over the counter drugs. you need the child's laboratory blood test need to be done routinely, so that we ensure that no complication will set in, and to be able to regulate the dose that will work for that child. Thank you.
Okay. Thanks for the answers. Um, what can I do for my children who refuse to be drinking water? I've lost
You
three
will
and I'm
start
left with
with
three.
juice. You will start with juice. You'll be missing juice, their favorite juice. You mix it with water, and you keep giving incentive. If you finish 100 mils today, this is what I'll give you. For that child that loves egg, you give her egg more. For that child that loves meat, you give incentive, and they start competing with drinking water. We are parents now, we know how to twist to turn them to do what we want. Start with juice. Drinking ordinary water may be stressful, but immediately they are on, you will be the one to be cautioning them later. Mix juice, let them know that it's good for them, and by the time they see that pain is they are not getting pain as frequent as before, and you let them know that it's the water, they will also they will want to listen to you.
Thank you. You know, the suggestions and answers you get from practical experiences is always different from theory
Ah,
involvement. Thanks for that. Then this is there a medium to reach out to people with sickle cell disease in mass?
yes, we have sickle cell club. Every teaching hospital that I've heard of in Southwest has a thriving sickle cell club. And there are also NGOs that work with sickle cell. I know that the one in Lutz is much more publicized, but every teaching hospital has a sickle cell club. When you get to HCAC, anywhere they have sickle cell club. That is why we meet regularly, monthly, to educate ourselves, to encourage ourselves, and to ensure that we listen to our fears. You know, when you have colleagues with the same situation talking to you, it makes sense than just somebody with head knowledge.
Yep. Thank you. Then we have please ma, how do women with sickle cell manage pregnancy?
That individual with sickle cell disease that has now been pregnant must always go for his clinic. He or she will have the woman now we have an attending consultant to her case, so she will be sure that she does not miss any of her antenatal clinic. At that antenatal clinic, you will be put through different examination. The nurse will assist you, they will ensure that the fetus is growing. Then you too, you do ultrasound, you will be asked about your routine drugs. Then you reduce stress to the minimum, because you're already stressed. If you are at a job that is stressing you, you could go and negotiate for leave without pay for that period, so that at least you get more rest than before. Then you eat more. Now, if you were taking protein on maybe only lunch, before you put it to morning, afternoon, night, your balanced diet is a must. You ensure that you get support. I'm getting there. You cannot be an individual with sickle cell disease and live alone. No, you need support. You need support to put yourself in a group of people that can actually support you. If you have living parents, you are lucky. They are there to be your cheerleader. They will be there to help you. They will remind you, because at times you have this surge of energy. You want to finish writing this paper tonight. They will call you. Why are you still online? Can you please switch off and go and sleep? You need people that will keep checking you when you are going to the extreme. As a pregnant woman with sickle cell, you need more care. That is not the time you start thinking about you need money and your BP will rise. No, you need help. You need help. So put yourself, don't hide your pregnancy. If you have a spouse that accepts your pregnancy, you are lucky. You seek for help. You know, most of the time we want to play I'm superwoman. No. When people, if they are not even stretching out that help to you, you ask for it. People are they are kind than what it's so unfortunate that in the environment we are putting ourselves now, we try to imitate the advanced world where you shield relative out of your life. No, you put yourself in places where you can get support from colleagues, support even from your health profession, means of asking question. I'm feeling like this, what do I do? You need special care. It is not the time that you will think, okay, you may be so lucky, there may be no crisis throughout pregnancy, but it is rare because your body needs more blood. The baby is asking his own. You are adding weight. So it's, but from my experience, my first pregnancy, there was no crisis throughout pregnancy because it was my first. They had prepared, had eaten, had taken my routine, and the spirituality, you can't overrule it. We are spirit people. Whatever works for you, you try and keep your faith up. That thing you have faith in, that keeps you going in other areas of life. Make sure you capitalize on it, even for your health. If you are a Christian, you pray more. If you are a Muslim, whatsoever your faith, don't get um don't get it out of sight. Rely more on God. Anyone can be, anything can happen, but God is the only one that can help you. When you are pregnant, you can't miss your clinic. Please don't use faith to it's not for a woman with sickle cell disease to registered in Ile Agbebi. No, you go to the hospital where you will see medical practitioner. If you need blood, you can have access to it. If you need analgesic, they will know the one that will help you, that will have lesser complication on the growing fetus. And your life first, please speak up, seek for help, registered at the antenatal clinic, talk to the doctor even if it's not asking. For some people with sickle cell disease, you will not know by looking at them. They have big stature, they are huge, but you divulge the information. My genotype is HBSS and I'm pregnant. How can you help me? What can I do more that will help me? Please speak up. Don't hide anything. Don't hide anything. Sickle cell disease is not a communicable infection, and it is not a deadly disease. You just need to have knowledge and ensure that you use your knowledge right. It is not for somebody with sickle cell disease and is pregnant to start fasting and prayer for 7 days. No, you eat, God answers your prayer while eating. There are some stress you don't combine with pregnancy. Do you get that? Thank
Yes,
you.
yes. Thank you very much. Whew, our time is running up and we need to attend to some questions. We have, is it possible to change the genotype at fetal status in advanced country? Is it possible?
I don't know. There is nothing impossible under the sun. Maybe they are still doing that that clinical trial. I
All
don't
right.
know, but you can check.
Okay, thank you. Then we'll have this one. How much is the comprehensive neonatal screening? We've had
It has
Victoria
been
say 2.5. So,
subsidized. It's 2,000
okay.
naira 500, 2,500 naira. It has been grossly subsidized. Please preach it and let everyone that is pregnant know. Newborn screening is the in thing now for Nigeria. That's the level we are.
Okay, I think we've gone through all these questions. The only remaining one are the new ones that came in, which are not questions but comments. Oh, ladies, gentlemen, children, if we have any, gentle ladies, men, everyone that joined us on here today. It's really a huge pleasure having you and interacting with you and our dear guest, Dr. Oluwayemisi Olagunju, who really spoke passionately, answered passionately to every single question that we drew here. It's not been an easy now. We've spent 110 minutes. So I don't want to call it in hours. I just wanted to make it minutes so you could actually see the time we've spent here talking and discussing on a topic that is worth it, sickle cell disease. Thank you absolutely for making out your time to join in. Thank you for being quite an interactive audience. Thank you for the accolades you keep showering for to our guests today. And once again, remember that this was brought to you by Tumim NG. I will just have a quick look through along this comments and we will really wrap it up and call it a day. Adoniran, God bless you both for this great teaching. Thank you. Esther, Abulo Oloke Marin actually did well in enlightenment for family planning. Okay. Felicia, well done, ma. Esther, family health and family planning with reference to the previous comment. Then we have Esther, the ordeal SCD, sickle cell disease, is totally avoidable. Dr. Adeshola, we shall be your ambassadors. God help us. Thank you. Then we have
Amen.
Monday. Beautiful presentation, Dr. Lagunju. Well done. Olutola, my name is Olutola. We are two in our family, and God has been everything for me and my brother. He's married, but I'm still trusting God. What can I do? Because ladies get to know and end our relationship. Oh God. The Yemisi Dr. Yemisi is an example. Okay, Lanre said Dr. Yemisi is an example of how God makes his strength perfect in weakness. I'm glad that you're a survivor and going back to the society to the glory of God. Great. Titi, happy for you, Dr. Yemisi. Truly, you're a blessing to this generation. You shall fulfill your days in Jesus' name. Amen. Abanum, thank you so much, Dr. Olagunju. Then, Beatrice, very informative. Thank you, the wonderful team. Thank you, too. Faith, shout out to my wonderful lecturer, Dr. Olagunju. God bless and strengthen you the more, ma. Thank you. Mary, thanks, Dr. Yemisi. Thank you. And Faith, shout out to our host. God bless you. Thank you, Faith. And then we have Sakiru. Many thanks and more blessings of God. Emmanuel, great presentation.
That's very
Olaoye,
true.
Sumi Menji, you're doing a great job. More power to your elbow. Ladies and gentlemen, thanks amazingly for your time. I guess Dr. Lagunju wants to say a word or two before we wrap up everything and really call it. So,
Thank you. I want to appreciate Sumin NG for this platform. And I want to say a very big thank you to all my teachers. They are all present here. All the accolades, they are from my teachers. The community of nurses, I'm proud of you. We are celebrated. You've contributed one way or the other to ensuring that I keep coping with sickle cell disease. And because we have this platform today, I want to still remind every one of us that please be the mouth for sickle cell disease. Give a voice to sickle cell disease. And together, let's work to eradicate this menace. And to people out there with sickle cell disease children, don't give up. You can do it with God by your side. Don't trivialize your coping mechanism. If it is spirituality, work on it. If it is active coping, seeking help, accepting tangible support, and asking for support, please. And for us all, let's stop stigmatizing sickle cell disease. The people with sickle cell disease are not different. People say, Ajayi, kògbókògbó, they may die. Anyone can die. People have died more with road traffic accidents than you may think of sickle cell disease. Let's keep encouraging them. Let's give them hope to live. Stop the stigma. Sickle cell disease is not a death warrant. We can actually do it. Let's keep pushing. And one day we'll see the society of our dream, society that is free of sickle cell disease. Thank you once again for joining. I'm really grateful. God bless everyone. Thank you.
Oh, I didn't realize that I was muted at some point, and I don't know how much of my comments have been heard. But whichever is the case, thank you everyone for joining in. Thank you absolutely for everything you've joined in today. Thanks to our special guest, Dr. Oluwayemisi Olagunju, and thanks everyone again. This is brought to you by Tumim NG. This is our YouTube channel. Do well to subscribe, turn on the notifications. Definitely, you will always see this come up to you. This is an educational platform. You can teach, you can also learn. For any inquiry, you can see all our contact channels or contact platforms there scrolling down the screen. Please do well to contact us and we'll be happy to have you. Thank you once more. And I remain Dr. Ifnaya Stelamaris. I am commonly known as Dr. STM. And thank you to our dear host, Dr. Lua Yemisi. Bye bye, everybody, and see you next time.